Hey Kenny, I'm student clinician Esteban Diaz. Nice to meet you. So based on everything that went over your case, the differential diagnosis is multiple sclerosis or pernicious anemia. Have you get up? And can you walk that way? And can you walk this way? And you can go ahead and have a seat. Alright, so for this we're checking ambulation and gait, seeing if he needed help walking, which he didn't, and gait to see if there was any abnormal posture leaning to one side or the other. So now we're gonna do some neuro exams. We're gonna start with, let me get the light. So we're gonna start with direct lights. Okay, look straight. Okay, so for this, we want to have ipsilateral pupillary constriction when light is shining in the eye. Now we're going to go ahead and do indirect. Okay. Perfect. Now for this, we want to see contralateral pupillary constriction when light is shining in the eye. And for both of these, the afferent is going to be the optic nerve 2. The efferent is going to be oculomotor nerve 3. And the integration center for both is going to be at the midbrain. Now we're going to do the extraocular eye movement. So for this, we're just going to do an H. So follow my finger. And for this, we're checking for normal conjugation and parallel eye movement. Now we're going to do accommodation. So I got my finger and just follow my finger. Okay, so for this, we want to see convergence of the eye with the pupillary constriction. The afferent is optic nerve 2 and efferent is optic nerve 3, and the integration center is the occipital cortex. Now we're going to do the jaw jerk, and for this we need the reflex hammer. So I'm going to put my finger right here and tap. Okay, so for this we want to see an upward movement without deviation to either side. The afferent and efferent is the trigeminal nerve, and the integration center is at the pons. Now we're going to check for the soft palate. For this, we need the light and we need a tongue depressor. So it's sterile. I'm going to open it up. And I'm going to shine. Can you open your mouth? And say ah. And we're going to depress the tongue with this. Alright. So for this, we're just checking for symmetry and the rising of the soft palate and seeing if there's any paralysis. Okay, Kenny, now we're going to be inspecting the hypoglossal nerve. So can you just open your mouth? Okay, here we're checking to see if there's any atrophy, vascularization, or deviation in the tongue. Can you stick your tongue out for me? Okay, now we're checking to see if the tongue deviated to either side. And now, can you, with your tongue, apply pressure to the side of the cheek? Now apply some pressure here. And then the other side. Okay, that's good. We also want to see for unilateral paralysis, so protrusion of tongue, deviation to an involved side. Okay, Kenny, now we're going to do the Fukuda step test. Can I have you stand up? Bring your arms out to the front. And can you step up like this? Do that. Okay, now let me have you close your eyes and keep doing it. Okay, 48, 49, 50. You can stop now. Thank you. So for this, we want to see if they're turning to one side, and this will indicate a vestibular lesion on the side of rotation. All right, Kenny, can I stand up? Face me. Okay, can you put your finger in your nose? And then can you touch my finger? Okay. Good. For this, we're checking for dysmetria. Can I have you sit down? All right. And for this, I want you to just start patting your knees, your legs. There you go. And can you go as fast as you can? All right, good. This, we're checking for diadokinesia. All right, Kenny. Now we're going to do Hoffman test. So can I see your hand? Okay, we're going to stabilize the middle finger. And we're going to flip. And the other my finger. And we're going to flick. Okay, so for this, for this test, we want to see a flexion and a deduction of the thumb with flexion of the finger indicates. an upper motor neuron lesion in the cervical cord or brain. We're going to be checking for the plantar reflex. We're going to check for Babinski sign. And for this, we want to go up on the outer edge, go this way, good. And we want to go, good. So for this, we use the bottom of the reflex hammer. And what we wanted to see was the toes move downward into plantar flexion. A Babinski sign would be when the toes go up in a dorsiflexion, and this would be a sign of a motor neuron lesion.